So there is exactly 2 days left. That's right. I'm gonna make this really quick because we have a lot to cover in a little amount of time. So I am so excited to be able to mark this goal off my list and consider this journey accomplished and fulfilled. So now a couple of things. Yesterday I had my pre-op at the actual hospital where the procedure is taking place. Part of what goes on in the pre-op is when you arrive, you check in, you let them know that you're here to pay all of your hospital fees and sign all of your documents. Basically, this is where they go over with you the procedure. So as far as the hospital is concerned. So you check in, you meet with the registrar, you sign all your documents and your paperwork, you make sure your address is correct, your date of birth is correct, the spelling of your name is correct, and all that good stuff. Submit a copy of your photo ID and things of that nature. Since no insurance is involved in this type of procedure, it's considered an elective procedure. I didn't have to use any of that information. My job didn't matter and that kind of thing. They basically just need your name, your address, emergency contact, not to scare you, but they do ask if you have a living will or any dependents or beneficiaries that you like to list if in the event that something takes place. But we all know that's not going to happen. After that, after you speak with the registrar, they let you go back to the nurse's station. At the nurse's station, that's where they do your blood work and you get a nice little nude band-aid. Okay, and they also do a CBC. CBC stands for collective blood count. So there's a number of things that they check with that blood sample that they take. In addition to that, they will do a blood pregnancy test, and we both know there's no issues there. Because I opted at the last minute to go ahead and stay the night at the hospital, I had to do this weird nose swab thing. And basically what that is to make sure that you're not bringing in any staph infections to the facility. And then once you leave, they'll do it again to make sure that you're not taking any staph illnesses away. And I really commend them for implementing that, because that's not something that I've ever had done before. Even having my children, I didn't have that. So I think that's a good thing. Also, they'll just go over a whole bunch of pros and cons and legal stuff. So at this point, this is when they ask you, why are you wanting to have this procedure? They basically just want to make sure it's no one forcing you, and also that you don't have any false hopes of this procedure is going to, give me $1 million or it's going to, change my whole life and this and that. They want to make sure that it's something that you're doing on your own. They also give you this really cool bag, which I thought was cute. And they put in copies of your documents that you sign, and also a, I guess, cleaning solution, some type of antibacterial cleaning solution that I'm supposed to bathe with the morning before I check into the hospital. And this goes from your chest down. She did stress to me not to put this on my face or anywhere near my face. But everywhere else, you gotta put this. Also, I'm gonna go over a few things that were really important that I had to sign. If you're a smoker, they want you to stop smoking prior to this procedure. They also want to make sure that you're not experiencing any type of depression or suicidal thoughts. And so when you check in, they're going to ask you that, but that's just protocol. Don't think of them as being weird, because that's just something they have to do. They tell you that you want an initial where they went over pain management, antibiotic safety, and infection control, which again was the swab test to make sure that there's no staph infection present at the time of your procedure. Also, they ask you if you have any flu-like symptoms, if you traveled outside the U.S. within the last 45 days, things of that nature, just to make sure that everything is copacetic in that area. They go over on your arrival, report to the registration desk the date of surgery. It's important that you arrive on time to be assigned. You and your family will be directed to the appropriate area to wait for surgery. Okay. Also, they did stress that I am on time to prevent delays, because even though I'm the first person to have surgery that day, I am not the only person to have surgery that day. And I want to be respectful and mindful of the time of everyone involved, my doctors, nurses, things of that nature. It says we ask that you complete your name and birthday as our 2 patient identifiers. So when you come in to check in the morning of, they're going to ask you, is this correct? Is this your name? Is this your date of birth? They'll give you the little cute hospital paper plastic, thing. And then you'll have to check that and make sure that it's correct. I've noticed lately they have a barcode on them, and they scan it every time you enter or exit a room within the hospital, every time you're administered any type of medication, things of that sort. They'll scan it just to confirm that this is you, and to keep a tally or a record of the areas that you've been in the hospital and the medication that you've been assigned. It also says your physician will come to the pre-anesthesia area and verify your identity, verify the type of surgery that you're having. If applicable, the surgery type together with the physician, you will mark yes on the area where the incision will be made. Someone from the anesthesia department will interview you in this area also. I did experience that a little bit on yesterday's visit to the pre-op. I had to initial that this is my name, this is my date of birth, and this is the procedure that I elected to have. All of the documents that I signed had the procedure in great detail at the bottom. And some of them were even highlighted forms. So you won't have that weird thing that you see on some comedy shows, to where you go in for one thing and then you come out with something else. Like, I don't want to go in for a tummy tuck and then come out with my gallbladder removed, because that's not cute. I didn't pay for that. So anyway, that's what that is. Then it goes over after surgery. Following your surgery, you'll be taken to a recovery room until your condition is satisfactory for discharge. The usual time is 1 to 2 hours. You'll wake up in the recovery room with a cool mist oxygen mask and will be asked to breathe deep and cough to reduce chances of pneumonia. This will aid in expelling mucus that may have collected in your lungs as a result of anesthesia. Your recovery room nurse will be at your bedside at all times, monitoring your vital signs until you're awake from anesthesia. Pain medication will be given in recovery if needed. It is unlikely that you will be in total pain, that you will be totally pain-free in the immediate post-op period, but the nurse will take care to keep your pain under control. That's another thing I want to pause and go over. The anesthesia that you're given as part of the package is different from the Exparel. And I hope I'm saying that right. The Exparel is supposed to be this more advanced medicine that they administer for surgeries such as this. From what I understand, it's an injection that's made inside your muscle once you are open. In the recovery room, when the doctor has made the incision, he will inject this medicine inside the muscle. And what that does, from my understanding, is that it kind of prolongs the numbness, or it makes the medicine last a whole lot longer. So whereas a typical anesthetic would probably last 4 to 5 hours after your surgery, the Exparel will last, from what I've understood, 72 hours after your surgery. And that's pretty cool, because if you're not going to stay overnight and you are going to go home, that was a fear of mine, is going home and being in pain and can't drive to the hospital, and I don't have anybody there to, help me deal with the pain. So having the Exparel, I would advise to do it. It is not covered with the procedure fees already. It's not included. So that's something that you would have to add. And here in Texas, it's $400, or at least it's $400 for the hospital that I'm going to. So that was something I wanted to throw out there. It also says it is possible that you may wake up with one or more of the following: catheters, tubes, drains, etc. I do know that there will be about 3 to 4 tubes inside the what do you call it? The wraps that they put around you, the gauze or whatever. And so those tubes will be removed from the surgeon, if I'm not mistaken, about a week to a week and a half after your surgery. You'll go back to your doctor, and depending on your healing at that point, he'll remove those tubes, those drain tubes. They'll also show you how to clean those tubes and things of that nature before you get discharged from the hospital. Your IV for your fluids during the surgery, and to administer any medications before, during, or after the surgery is ordered by the physician. The Foley catheter is to drain bladder and help alleviate your fluid balance. So those are some items for after surgery. This just went over adult pre-procedure instructions, which I talked about already. And over here to the side, she just really emphasized not to have anything by mouth after midnight. So no water, no Jello, nothing at all. No Advil, no Midrin, which is what I take for my migraines, and no BC powder. No Motrin as well. Take any medication or stop any medication as directed by your doctor. Stop all herbal medications 2 weeks prior to your procedure. And that's real important, because if you've been trying to lose weight prior to the procedure and you've been taking herbal supplements, you want to stop taking those. Bring extra money, credit cards for incidentals. If you're taking blood thinners, please consult with your physician when to stop. Stop all aspirin or aspirin-containing products 72 hours prior to the procedure. Okay, so we went over that. Hair at the surgical site should be left in place, not shaved. Preoperative shaving of the surgical site increases the risk of surgical site infection. And I went over that. You must arrange for a friend or family member to drive you home after your surgery. Visitors should be limited to 2 per patient, and we ask that you do not bring children other than the patient. And in this case, no children will have this type of procedure. Wear comfortable clothing. So that's another issue. I'll be packing my bags today. Comfortable, loose clothing. No makeup. They did stress that. No makeup, no jewelry, no lashes, no nothing. Basically, no watches, no rings, no new tattoos. So you just want to be plain. So I'll probably just have my hair in a bun, no makeup, big comfortable t-shirt, pajama pants, slippers, and socks. I think it's really, really imperative that in your hospital bag, you need to pack socks. And I learned that from having 3 children. Every time I pack my hospital bag, I always had socks because I'm always cold. So that pretty much is it. I think I've covered a lot of territory in a little bit of time. If I have time later on, before the big day, I will come back with another video, because I still haven't taught you guys how to do your BMI calculations. I'll also go over what I've put in my hospital bag when I actually pack it. Right now, it's just all about keeping the house spotless and having bleach in every room, Lysol. I have gloves. I have a lot of cleaning supplies, just to put it bluntly. And I think I'm officially ready. So if I have time, not making any promises, I will do another video before the big day. Other than that, I will see you guys on the big day, and you'll actually be in the surgery room with me. How cool is that? So have a blessed day. Talk to you later.